Chapter 1: The Impact of Processed Foods and Additives. Number 1 on the list: processed foods and additives. Critics contend that many processed foods are teeming with additives, preservatives, artificial colors, and flavorings that could be detrimental to our health. The high levels of salt, sugar, and unhealthy fats found in these foods are also associated with chronic health conditions. Chapter 2: The Dangers of Sugar and Sweetened Beverages. Secondly, sugar and sweetened beverages. The overconsumption of added sugars, especially from sugary drinks and processed snacks, is linked to a myriad of health problems, including obesity, type 2 diabetes, and cardiovascular diseases. Chapter 3: The Impact of Unhealthy Fats. Thirdly, unhealthy fats. Some processed foods are notorious for their high content of unhealthy trans fats and saturated fats, which are implicated in heart disease and other health dilemmas. Chapter 4: Misleading Marketing Tactics. Fourth, misleading marketing. Critics challenge the marketing tactics used by the food industry, arguing that they can often be deceptive, making products appear healthier than they really are and contributing to consumer confusion about nutritional choices. Chapter 5: Debates on GMOs and Pesticides. Fifth, GMOs and pesticides. The use of genetically modified organisms and pesticides in agriculture have sparked debates about their potential impact on human health, with critics claiming that the long-term effects remain unknown. Chapter 6: Antibiotics in Livestock and Human Health. Sixth, antibiotics in livestock. The use of antibiotics in animal farming is criticized for bolstering antibiotic resistance, a growing threat to human health. Chapter 7: The Environmental Impact of Food Production. Seventh, environmental impact. Industrial agriculture practices and food production systems can have a negative environmental footprint, including pollution, deforestation, and the depletion of natural resources. Chapter 8: The Role of Portion Sizes and Overeating. Eighth, portion sizes and overeating. Some critics argue that the food industry promotes larger portion sizes, leading to overeating and contributing to the obesity epidemic. Chapter 9: The Surge of Ultra-Processed Foods. Ninth, ultra-processed foods. The surge of ultra-processed foods, often laden with low-nutrient, energy-dense ingredients, is tied to poor dietary habits and related health problems. Chapter 10: Lack of access to healthy foods. And finally, lack of access to healthy foods. In some regions, there's a dearth of affordable, fresh, and healthy food options, leading to disparities in nutrition and contributing to health inequalities. Chapter 11: The Diverse Nature of the Food Industry. However, it's crucial to remember that the food industry is diverse, with many companies dedicated to providing healthy, sustainable, and ethically produced food. Also, regulations and oversight play a pivotal role in safeguarding food safety and quality. Chapter 12: Addressing Concerns and Initiatives for Change. Addressing these concerns often involves regulatory measures, consumer education, and industry initiatives. Increased awareness, advocacy for healthier food policies, and making individual choices towards a balanced, varied diet are all vital to promoting a healthier food environment. Public health organizations, policymakers, and the food industry itself are actively engaged in discussions and initiatives to improve the healthfulness of our food supply. Chapter 13: Finding Solutions and Moving Forward. So, while there might be challenges, it's evident that there are also solutions and initiatives in place to tackle these issues head-on. The food industry, as complex as it might be, is not a one-size-fits-all entity, and it's important to continue the conversation about its role in our health.